bienvenido a su programa de conversación abierta con el reverendo Bolívar Flores. Hoy es viernes 30 de mayo 2025, un viernes más que el Señor nos permite traerles informaciones de primera a cada uno de ustedes. Y quiero agradecerle externamente a todo nuestro equipo de producción, a nuestro director Cristóbal Serrano, Rita Durán, Madeline Castro, Femier, y a todo el equipo de producción que hace una producción a la altura de cada uno de ustedes. Pero primeramente, gracias a ustedes por darnos el privilegio, el honor de entrar hasta sus casas, hasta sus autos, hasta sus trabajos. Pero lo más importante, por darnos el privilegio de entrar hasta sus corazones. Conversaciones Abiertas es un programa sin fines de lucro a favor de las personas más vulnerables de nuestro estado. Y esta producción es traída gracias al patrocinio de Hudson Community College, gracias al patrocinio del rabino Abed Friedman, de Wendy Nu y de Francine Lafrac. Así que esta es una producción que traemos todos los viernes para informar, para educar a nuestra comunidad. Conversación Abierta con el reverendo Flores en el día de hoy se siente honrado y privilegiado de tener a la presidenta del Bergen Medical Center, un hospital enfocado en desintoxicaciones de personas con historial adictivo en el condado de Bergen County, clasificado como el hospital más grande del estado de Nueva Jersey. Y hoy nos acompaña Deborah. Deborah, welcome to Open Conversation with Reverend Flores. How are you?
Okay, how are you doing, Reverend? Thank you for having me.
It's my pleasure, Deborah. Deborah, tell me a little bit about your background.
So, my background is that I am a Puerto Rican girl from Brooklyn. I was born in Brooklyn, New York, to Puerto Rican parents. And I grew up in an underserved community in East New York, Brooklyn. And I have always had this sense to serve communities. You know, having lived and learned firsthand what it's like to live in an underprivileged community and be in an underserved family, I really had this purpose to serve. It was my North Star to serve. And so I got into healthcare at an early age. I started my career as a phlebotomist, you know, the people that draw blood early morning. And I'm a lab tech by background. So I grew up clinically in the laboratories and wanted to pursue my career further. And I got my master's degree in health administration and have been growing my career for the last 25 or 30 years, from phlebotomist to president and CEO of Bergen Newbridge Medical Center, where I am today.
And tell me a little bit about the history of the Bergen Medical Center.
So Bergen Newbridge Medical Center is the largest hospital in the state of New Jersey. It was founded well over 100 years ago. It's a county-owned facility, so it was founded by what they were called the freeholders at the time, the Bergen County freeholders. Now they're called the commissioners.
Yep.
The Bergen County commissioners. And the history was that it was formed to combat the public health issues of the time in the community. Back then, 100 years ago, it was tuberculosis and scarlet fever. It was called the isolation hospital. But if you fast forward 106, 110 years later, where we are today as Bergen Newbridge Medical Center, we are that beacon of health, hope, and healing for our communities. And we serve the most vulnerable communities in the state of New Jersey. And we have a specialty in behavioral health, mental health, and addiction services, as well as serving the geriatric population through our long-term care facility.
For how long you're the president?
So I've been the president and CEO for 7.5 years. I got there October of 2017.
And tell me a little bit about the demographic that you have the pleasure to serve.
So we serve vulnerable populations. So 70% of our population is Medicaid recipient. The other 10 to 12% are individuals without any insurance, so they fall under our charity care umbrella. And then the rest of the population is commercially insured individuals. We serve everybody in our community. We are positioned to serve individuals throughout their entire lifespan, from young children to adolescents to young adults, all the way up to the geriatric population. So, you know, our demographics are far-reaching and broad.
Deborah, first I want to say thank you, because thanks to your leadership, thanks to the hospital, You serve our population, the reentry population, and thanks to you, we saving life. So thank you for being
Thank
that.
you. Yes.
But Deborah, can you tell me a little bit about the pandemic that we live in the state of New Jersey? And we can see all the Houston County, 200 something overdose in the state. We see Essex County, 100 something overdose. That pandemic that we live, what do we do? How we fight back?
So, as you noted, there's hundreds of individuals, thousands of people that die of overdoses every day. And this disease, and that's what it is a disease, knows no boundaries, knows no socioeconomic boundaries or gender boundaries or demographic boundaries. It affects everyone. And so as leaders in healthcare, as community leaders, to me, it is our responsibility to be able to provide no wrong door policy so that any individual suffering from an addiction, regardless of whether it's a drug or alcohol or both, there will be no wrong door when they get to Bergen Newbridge. We will take them in no matter what time of day to be able to give them the treatment that they deserve and to be able to get them onto the journey of recovery and to stay in recovery through their lifetime. So for me, it's really about being out in the community, partnerships like the ones we have with New Jersey Reentry Corporation, but with many others in our communities, is to partner to identify individuals. We work very closely with the school systems so that we can identify the adolescents and the young people before they get addicted and before we lose a life. So for us, it is truly a privilege to be able to be that beacon of health and hope for our communities, regardless of where the people are. I believe that we have to meet the people where they are so that we can give them the care that they need and they deserve.
Detox. Can you tell me a little bit why detox is important and what does detox mean?
So at Bergen Newbridge, we have what we call a medically managed inpatient unit. It used to be called detox. And detox means that we help individuals in a medically managed environment, which is a safe environment, get the drugs out of their system through different medications and different processes. And then once the drug is out of the system, it takes about 3 to 5 days to completely detox. Then the individual is not done yet with their treatment. They have to go through what we call a rehabilitation, which is a couple of weeks usually. We have those units at our hospital at Bergen Newbridge. We have rehab units, rehab divisions where individuals can go and spend time and they get counseling and different types of therapy.
And they sleep there, they stay there?
They stay there for about 2 weeks until we believe that they're ready to go to the next level of their recovery, which could be back into the community, back into their homes. We have a great partnership with Integrity House, where sometimes individuals go to Integrity House for residential treatment.
Sure.
So there's a lot of different avenues. And, what's really special about the way that we take care of these individuals is not just that there's no wrong door and we take care of anyone, but it's also that we have a warm handoff, that we make sure that when an individual leaves our care, we have given a warm handoff to where they're going to go next, which will help their long-term recovery and be able to stay in recovery.
You have a Bible name, Deborah. You know who's Deborah in the Bible, but also 7 year, what we call the perfect number in the theology. You're a woman of faith?
Yes.
And how are you connecting, believing in God and see these people sometimes condemned by this addiction? What do you think? You believe you receive a calling to the Lord to do this work? And can you explain to us a little bit about?
Yeah, I do think that there's definitely a calling, from an early point in my life. And because I saw people that needed care that weren't able to get it because of their circumstance in life. And I always felt that there has to be a better way for humans. Everyone deserves that right to have health care and be treated with equity and respect. And I believe that if you have an addiction, or same as if you have cancer or heart disease, it's a disease. And we are there to help cure that disease. And, not every disease, sometimes you live with heart disease forever and you have to be on medication forever, similar to addiction, right? It's something that you have forever. And so you have to be able to, be aware that it's a lifelong process to get into recovery, to recover and stay in recovery. So, that's how I believe that individuals, just because you have an addiction, it doesn't make you a bad person. You have a disease.
Wow. Let's go to commercial and we come back.
Okay.
Vamos a unos cortes comerciales y regresamos en breve hablando sobre tan importante tópico como es el tópico de la adicción con una de las nuestras, una latina, en el cargo de presidenta de Newbridge Medical Center. Regresamos en breve, manténganse en sintonía. El Sabor del Café Restaurant está ubicado en el 31 de la Martin Luther King en Jersey City, Nueva Jersey 07305. A través de la experiencia y dedicación de su chef Cándido Ortiz, usted puede disfrutar de una gama de comida latinoamericana. Así que les invitamos al Sabor del Café a probar esta gama de comida del chef Ortiz. Cuando se habla de belleza y se habla de buen tratamiento para tu pelo, debe visitar Kaylee's Salon, ubicado en el 28 de la Martin Luther King Drive en Jersey City, Nueva Jersey. A través de la dirección de su directora ejecutiva, Yamile Martínez, puede contactarse al 201-687-4266. Para una buena cabellera, para un buen pelo saludable, visite a Kaylee's Salon. Buenas tardes y gracias por mantenerse en sintonía con este programa de conversación abierta con el reverendo Bolívar Flores. En el día de hoy yo me siento más que honrado, me siento privilegiado de ver en una posición de esta índole a una latina, una mujer que dedicó su vida a crecer en los laboratorios, a ser Flavarmit y hoy convertida ya 7 años en la presidenta de un hospital que es la luz de la vida de muchos que se encuentran encadenados a las adicciones. Y gracias a los servicios que se ofrecen en este hospital, gracias a la desintoxicación que se hace, pueden ser liberados de estas cadenas que vienen arrastrando por décadas y décadas. Deborah, so you speak Spanish. Tell me a little bit about in Spanish. ¿Cómo te sientes?
Me siento muy bien hoy, muy agradecida que estoy aquí con usted.
Deborah, cuéntanos un poco sobre por qué es importante el partnership. Why is so important that the hospital have a partnership with churches, with non-profit organizations, with community leaders? Why is that important?
So the hospital can't be successful in isolation by itself in the community. We do a certain role for the community, being, that beacon of health and hope and healing. But for me, partnerships are very important, in particular, faith leaders, because we view faith leaders as healers. And it gives us this incredible opportunity to bring faith and healing together under one umbrella. Faith leaders are also trusted partners in our communities. And so for me, working with faith leaders has been a very important part of the work that we do and reaching out into the communities to be able to get the voice out, to get the word out, to get that encouragement out to the community members. So, faith leaders have been incredibly important part of the work that we do. And other partners, we want to make sure that individuals that use our hospital for treatment have places that they can go outside of the walls of the hospital, right inside their communities. We recently partnered with supermarkets. I don't even know if you know about this, Reverend.
No.
We work with the Insera family with ShopRites, and we partner with them. We have primary care practices right inside ShopRite supermarkets. We have one in Wallington, ShopRite, and one in New Milford, and soon to have one in Garfield.
This is fantastic.
So, the way I look at it is if you can only get out of your house once a day, if you're taking care of a child or an elderly person, or if you have a disability, you can't get out. If you get out once a day, you usually go to the supermarket to buy food. That's human nature. So if you're in your supermarket and you're shopping for food, you can give your child a physical in our facility, in our practice, right inside ShopRite. You can get a vaccine. If you don't feel good, we could do a test for you. We could do blood tests. So that to me is a true partnership a very innovative partnership
Yep.
where we're thinking out of the box on how do we support our communities? How do we make sure that people have access to quality care wherever they are? So outreaching to the community, partnerships in the community, faith leaders, and that true engagement has been vital for us to be able to provide for our communities and be there for them.
So Deborah is not only Latina, she's brilliant. But anyways, Deborah, tell me a little bit about how many people you believe the hospital impact every year?
Oh gosh. Oh, hundreds of thousands of people. Hundreds of thousands of people through our emergency room, through our inpatient unit, through our long-term care unit, through our community work that we do, through veterans. We do work with our veterans, providing health care for veterans, through the New Jersey Reentry Corporation and taking care of those individuals and giving them resources that they need. So yeah, hundreds of thousands of people are impacted by the work that my team does, my extraordinary healthcare professionals do.
And Deborah, for the family, what type of support is that you have for them?
So yeah, well, addiction, mental health issues are a family disease and they impact everyone. And so we have support groups, counseling services for the families of the people that are affected and that we care for, because we want to be able to teach them how to help their loved ones, give them the resources, give them the education that they need in order for them to help their loved ones.
What do you think the parents have to be aware? What do you think is the sign that my son start use? Is any type of sound, is any language, body language that can be a part? How the parents can identify if the son start using drugs?
I would tell the parents to be aware of any changes in behavior, isolation, anger, sadness, things that are different than what your child is normally behaving. The types of individuals that they're hanging out with, perhaps, to see what kind of people they're hanging out with. I think now in the age of social media, it becomes a little more challenging for parents to know exactly what's going on in their child's world. But, social media could be a very dangerous thing for young people. But certainly behaviors, friends, withdrawal, not being part of family events or not wanting to go out of the house a lot. I would definitely keep eyes on that. We have a program, we call it Teen Thrive, which it allows people, whether it's a teacher or a parent, to identify potential problems with a child, with an adolescent, and then call us and enroll that child in the program. And we try to address the situation before it gets out of hand.
Deborah, thank you for being our champion. Thank you for being our leader. Thank you for being our Latina of the Year. I'm really proud to have you here on behalf of our churches, on behalf of the people that have the pleasure to represent. I want to say thank you for everything that you do. Thank you for dedicating your life, because 30 years is 30 years. So you have 30 years when I have only 5 years old. She just started working for our community. So thank you so much.
You don't have to put it that way.
Oh, okay. So, gracias. Muchísimas gracias.
Gracias por usted, estuvo muy amable.
Gracias. Y gracias a ustedes por mantenerse en sintonía con este programa de conversación abierta con el reverendo Flores. Hoy tuvimos una extraordinaria conversación con Débora, quien ha dedicado más de 30 años a luchar por nuestra comunidad. Gracias a ella, miles y miles de vidas se han salvado y han podido salir de la adicción. Será hasta nuestra próxima entrega, donde traeremos un programa a la calidad y a la altura de cada uno de ustedes. Hasta aquí ha llegado Conversación Abierta con el reverendo Flores. Bendiciones. El Sabor del Café Restaurant está ubicado en el 31 de la Martin Luther King en Jersey City, Nueva Jersey 07305. A través de la experiencia y dedicación de su chef Cándido Ortiz, usted puede disfrutar de una gama de comida latinoamericana. Así que les invitamos al Sabor del Café a probar esta gama de comida del chef Ortiz. Cuando se habla de belleza y se habla de buen tratamiento para tu pelo, debe visitar Kaylee's Salon, ubicado en el 28 de la Martin Luther King Drive en Jersey City, Nueva Jersey, a través de la dirección de su directora ejecutiva, Yamile Martínez. Puede contactarse al 201-687-4266 para una buena cabellera, para un buen pelo saludable.